Good afternoon, ladies and gentlemen who have joined us on this Dr. Fundi channel via multiple social media platforms, Facebook, YouTube, Twitter, Instagram, and also the Dr. Fundi website. Welcome back. For the last week or so, we have not been able to broadcast because of commitments elsewhere, but we are glad to be back with you today. Now, today, I've got a special guest, Ms. Rethabile Matolweni, who is a qualified occupational therapist, somebody who is an expert when it comes to matters of disability, whether we're talking about disability, in the workplace or beyond. So today I've invited her. She's not a stranger to this platform. A few weeks ago, I invited her to come and talk to us about disability in relation to people with albinism, the kind of disability that they normally present with when it comes to their visual challenges. But today, she is our guest to come and talk to us about strokes and the life after strokes. Now, this is an area of passion for Ms. Matolweni. So I hope that she will be able to share with us as much as she can, about everything that she knows in the next 60 to 90 minutes. But just to give a context, though, to the topic of today, on the 29th of October, which is about 3 days ago, it was the World Stroke Day, World Stroke Awareness Day. Now, when people listened on the various media platforms, whether it was on radio or TV, the focus was really on the medical side of strokes. What a stroke is, what are the symptoms of stroke, what are the causes, what are the different types of strokes, what are the risk factors, how is it treated, and all of that. But there was very little focus on once a stroke has happened, people lose some function, bodily function. What actually happens or what should be done from that point onwards? So today we'll spend most of the time focusing on the rehabilitation of stroke survivors. So we'll spend very little time on the medical side of the strokes. It's very important for one to understand, have a depth on the medical side of things. However, the focus or the bias of today will be on issues relating to function after the stroke. Now, I just want to give a context on the issue of strokes. There is an article that I read in preparation to today's interview with Ms. Matolweni. It's an article that was published on the South African Journal of Physiotherapists on the 22nd of July last year. An open access article, right? It was an article from a research that was done by Mogobadibe V. Nzia. And it was not the first time that she was publishing an article on issues of stroke. Now, in her introduction, she said stroke is one of the most common causes of morbidity or ill health in the and disability in South Africa, with the burden of stroke particularly high in rural South Africa.
Of course.
Right? And in this study, which was a narrative review study of all research done on stroke rehabilitation in South Africa, one of the things that she found was that stroke survivors in South Africa have poor functional ability at discharge from hospital. That was the first point. The second point was stroke survivors in South Africa have poor access to transport, work, and education. The other point she came up with was that caregivers experience strain and have poor quality of life. That is, those family members that look after the family member who is a survivor of a stroke, they themselves experience strain, which leads to poor quality of life. They also found that inpatient rehabilitation services in South Africa, they focus on the medical model.
Yeah, that's true.
Right. And then also, she also found that, or concluded that caregiver education alone and the use of pictorial exercise programs does not improve the patient functional ability and adherence to the home exercise programs. And therefore, she felt that there is a need for more focus on more research. There's a need to focus on post-rehab rehab services. And she listed a number of therapies that can be, considered. So with that background, Ms. Matolweni, welcome to the Dr. Fundi platform.
Thank you very much, Dr. Nyati. It's always a pleasure being here, and thank you for inviting me again.
Lovely. Yes, 3 days ago, it was the World Stroke Awareness Day. That was on the 29th of October.
Yes. Dr. Nyati, are you still here?